Welcome to Staging and Grading, Understanding the Numbers, a Canadian Cancer Society webcast. My name is Lacey Horta. I'm a Cancer Connection specialist and the moderator of cancerconnection.ca, and I'll be your host today. Our guest speaker today is Rosemary Mueller. She's been a senior information specialist with the Canadian Cancer Society's Cancer Information Service for 12 years. Prior to that, she practiced as a dietitian in the Niagara region, within the hospital system, community, and in private practice. Welcome, Rosemary.
Thanks for having me, Lacey.
Today we'll be discussing cancer staging and grading, why it's important, and ways to find cancer early. Before we get started, I have a few housekeeping items. The presentation screen you see in front of you is fully customizable. You can increase or decrease the size of the various windows, including the main slides area, speaker bios, and volume control, by left-clicking and dragging any of the corners. From time to time, we'll be referencing some useful resources or links to websites that inform our discussion. Please click the resource widget on the bottom of your screen to get access to these resources. And finally, if you're having any trouble with technology, please click the help widget, the question mark, at the bottom of your screen. Now, with all that out of the way, I'll hand it over to Rosemary.
Thanks, Lacey. It has been said that cancer is one of the scariest words in the English language. Cancer. For most people, when they hear the word, there are many thoughts and many emotions. People respond and react to the word in different ways. However, for most people, when they hear cancer, whether it's their own diagnosis, the diagnosis of a friend or relative, or related to a news article they have read, at some point there will be questions, and most often, many questions. We at the Canadian Cancer Society know that this happens, and in my role at the Cancer Information Service, I have been asked thousands of questions over the past 12 years. Though there may be many questions, it's important to know that cancer is a very complex disease. Often there isn't a simple answer or just one answer to a question. In fact, when you talk about cancer, you will often hear words like usually, most of the time, or not always. However, no matter if you are a person diagnosed with cancer or if you know someone with cancer or are interested in learning more about cancer, I hope that this webcast will help you to understand a small but important part of cancer basics, and that is staging and grading of cancer. To start today, I want to review what we hope to accomplish with this webcast, and that is to first define and better understand grading and staging of cancer, second, to learn why grade and stage are important, and third, to understand what you can do to help find cancer at an early stage. As well, throughout the webcast today, I'll share examples of calls that I have received to help show how stage and grade can affect a person's cancer journey. So I want to begin by reviewing some really common questions that people ask when they are beginning their cancer journey, and that is when they are first diagnosed. Why isn't the doctor telling me anything? Why do I have all of these appointments? Why do I have to have so many tests? Why can't they just start treating me? The doctor said I may not need treatment. I don't understand. Why can't they tell me how bad my cancer is? Many questions are asked, and often it seems like there are few answers. But it is important to know that the healthcare team will also have questions they want answered. The diagnosis is just the start of information that the healthcare team needs. Much more information can possibly be determined before treatment begins, and this can include information about stage and grade. So let's begin today by looking at grade of cancer. Grading describes how cancer cells look compared to normal healthy cells. This tells us how aggressive the cancer is and basically how likely and how quickly the cancer may spread. To find out the grade of a cancer, a pathologist looks at a sample from the tumor under a microscope. They analyze the sample and they look for a number of things. First, how different do the cancer cells look compared to normal cells? This includes features such as the size and shape of the cells. Second, they look at how fast the cells are growing and dividing. They will also look to see whether there are areas of cell death in the tumor, and this is called necrosis. This is very important information because grading is used to help predict how cancer will grow, which will then be used to help plan treatment. Doctors also use grade to predict how well a treatment will work and also to predict a person's outlook, which is called prognosis. So we know that grade refers to how aggressive a cancer is, and that is important in cancer care. So now let's turn our attention to how they actually assign a grade to a cancer. The actual way to describe grade can vary with the type of cancer. However, we can look at some general information because most solid cancer tumors are given a grade using either numbers and/or words. For the grade of a cancer, you will usually see numbers from 1 to 3 and sometimes 4. When a pathologist looks at a sample under the microscope, they assign a number to it between 1 and 4. The number depends on the amount of abnormality they see. In other words, how different do the cancer cells look compared to normal cells? In grade 1 tumors, the tumor cells appear close to normal. These tumors tend to grow and spread slowly. In contrast, cells given a grade 3 or 4 look very different from normal cells. These cancers tend to grow rapidly and spread faster than those with a lower grade. So the lower the number, the less aggressive the cancer. Grade can also be described using words. Low-grade cancers have cells that look a lot like normal cells with just some abnormalities. These are the ones that tend to grow slowly and are less likely to spread. High-grade cancer cells have cells that look very different from normal cells. They tend to grow more quickly and are more likely to spread. And intermediate-grade cancers fall between these two. You may also see the word differentiation. Differentiation refers to how developed the cancer cells are and how well they are organized in the tissue or organ. It's about, again, how they look under the microscope. Well-differentiated cancer cells look and behave more like normal cells. They tend to be less aggressive. This means they tend to grow and spread slowly. Undifferentiated or poorly differentiated cancer cells look and behave very differently from normal cells. They tend to be more aggressive. That means they tend to grow and spread more quickly. Moderately differentiated cancer cells fall between these two. When talking about grade, you can see different words or numbers, and this next slide puts all of the information into one chart. You'll see the numbers, grade 1, 2, 3, sometimes you'll see 4, well, moderately and poorly differentiated, and low, intermediate, and high grade. These are all the numbers and words your doctor may use when talking about your cancer, or you may see these words and numbers on reports and in your reading. Bottom line, the lower the grade, the slower growing the cancer is. The higher the grade, the more quickly and more likely the cancer will spread. This is important as it also refers to prognosis and treatment decisions. Generally, a lower grade indicates a better prognosis. A higher grade cancer may grow and spread more quickly and therefore may require immediate or more aggressive treatment. Grade is a really important piece of information that can affect a person's cancer journey. To help demonstrate this, I'd like to share one woman's story with you. One early afternoon, a middle-aged woman called the Cancer Information Service because she was trying to understand what had just happened at a doctor's appointment that morning. She was told information that was confusing and upsetting, and this is her story. A number of months ago, she was diagnosed with bladder cancer. The doctors told her they had caught her cancer early. She had a procedure done where they removed the tumor from the bladder. Afterwards, they told her that they had got it, and she was thrilled. They also told her that she would need close follow-up because bladder cancer often comes back. By following her closely, they hoped to be able to find these changes early and just be able to remove the cancer like the first time. Her first and second follow-up appointments were fine. However, on the third one, they did find another abnormal spot on her bladder. So again, she had it removed. Today was her follow-up appointment from that procedure. When she went to her appointment, the doctor told her that he thought she might need other treatment, something about wanting to put medication right into her bladder. Then she told me that they also discussed possibly removing her bladder. Today, she had simply expected to go to the doctor, be told everything was good, just like the last time, and just simply come back for follow-up. Since coming home from her appointment, she'd been reading on the internet, trying to find some answers. She didn't want to have her bladder removed, and she was reading about many people who had tumors removed many, many times. We then discussed all of the treatment options for bladder cancer, and it included the possibility of removing the bladder in certain situations. As we were talking, she was looking through all of the papers she had. She had reports and notes from each of her appointments. On one report, it said that her cancer was high grade. I then explained to her that the grade told the doctors how aggressive her cancer was and that they were using that fact to not only deal with the cancer she had, but also to decrease the chance of it coming back and spreading. Removing the bladder would be considered based on a number of factors, especially the grade of a cancer. She said that she does remember having the conversation with the doctor early on about the aggressiveness of her cancer. However, she had forgotten about that. She now realized that not all cancer patients with the same type of cancer would have the same treatment. The general explanation of grade allowed her to understand her situation better. It also provided her with information that would help her to have an informed discussion with her doctor at her next appointment. Hopefully, this story shows the importance of grade in terms of treatment decision, as well as how the information can help someone in their journey. So we have looked at grading systems in general, talked about how important it is in cancer care, so now I just want to expand a little bit more on grading. If you remember, at the beginning of the webcast, we talked a bit about how complex cancer is and how often there isn't just one answer to a question or just one way of looking at things. When we look at grading of cancers, we can see that there are many different ways to talk about it, using numbers and words. But to show how really complex cancer is, I want to look at one other example of how cancers are graded, because some types of cancers actually have their very own grading system, and this includes prostate cancer. This slide explains what is called the Gleason score. The Gleason scoring system is a very specific system used to grade prostate cancers. Like all grading, it's based on looking at the biopsy sample under the microscope. During a prostate biopsy, many samples will be taken. The pathologist will check each sample by looking at it under the microscope and determining how the cells look compared to normal prostate cells. Here's where it's a little bit different. It's a little more detailed system. The pathologist assigns a number for each difference they see. They give a number from 1 to 5, with 1 looking the most like normal prostate tissue and 5 looking the most abnormal. Then these two grades that he sees the most of are added together, and this gives a Gleason score. So a prostate cancer patient can be told that they have a Gleason score between 6 and 10, which tells them how aggressive the cancer is. Just like all of the grading information we've talked about, the lower the Gleason score, the less aggressive or the slower growing the cancer is. The higher the Gleason score, the more aggressive it is. Even though there are many details that can be used when grading cancers, we can just recap the basics of what we've learned about grading. Cancer cells are looked at under the microscope to determine grade. Grading tells us how aggressive the cancer is. It's used to help develop treatment and to determine a patient's prognosis. A higher grade cancer may grow and spread more quickly, may require immediate or more aggressive treatment. Generally, a lower grade indicates a better prognosis, and sometimes treatment may not be needed right away. So now that we've reviewed grading, let's turn our attention to staging. Staging is defined as the way of describing a cancer based on the extent of cancer in the body. In other words, has the cancer spread, and if so, how far? So grade tells us how aggressive a cancer is. Stage tells us how much cancer there is in the body. Staging is a process of finding out how much cancer is in the body and where it is located. Staging is done when a person is first diagnosed, and there are a number of possible tests and processes that can be done to help stage a cancer. It's important to know that each situation and each type of cancer may have different tests done to determine stage. And so, why is it important to know the stage of a cancer? Well, there are a number of reasons. Staging is used to help plan treatment. Many treatment guidelines and timelines are based on the specific specific stage. The order in which treatments are given can depend on the stage. Stage also helps to predict prognosis. Some of the most common questions that people ask when first diagnosed: will I die? Can my cancer be cured? What can I expect? Well, even though each person is different and each cancer experience unique, we can make some generalizations. Cancer staging is a way to group cases together and predict someone's chance of recovery, survival, and also help predict whether the cancer will grow, spread, or come back after the treatment. Stage can also help predict how well the treatment will work. Again, although each person's situation is different, cancers with the same stage tend to have similar outlooks and so are often treated the same way. Doctors need to know the amount of cancer and where it is in the body to be able to choose the best treatment option. In turn, staging information is always very helpful for the cancer patient. It can help the person with cancer better understand their diagnosis, better understand their treatment options, as well as better understand the possible outcome. So now let's look at one story from a call I received that helps explain this. A man in his early 20s called and wanted to know why the doctors were only going to do surgery for his cancer and nothing else. His question was, isn't the more treatment you have, the better? He would like to have more treatment to give him a better chance. We talked about his story. He had been diagnosed with testicular cancer and had had surgery. After the surgery, they provided him with all of the information they had gotten by analyzing everything they removed. They told him that they had got all the cancer and that he would now have close follow-up. If at any time the cancer returned, they'd be able to find it early and then treat it as soon as possible. The young man felt it would be better to do more treatment now, just in case. He feels it would be better and wants to ask his doctor about it. So we went through all of the information he had, and he actually had a copy of his pathology results, and in that it indicated that he had an early-stage low-grade cancer. When looking at information about treatment guidelines for his specific type of early-stage testicular cancer, we found that often the best option was surgery followed by active surveillance. Active surveillance means regular and frequent follow-up to look for signs and symptoms that the cancer has come back. This is exactly what his doctors had recommended. We talked about how this approach avoids problems or side effects that some of these additional treatments may cause. More treatments were only recommended if his cancer came back. So we can see from this example that stage and also grade were both important in determining his treatment, in determining his good prognosis, and also in determining his follow-up care. So now let's look at some of the details around staging. We can begin by looking at how stage is determined. Just as there are different systems used to review the grade of a cancer, there's also different systems for staging. Some cancers have very specific staging systems. However, for most cancers that form solid tumors, the most common and widely used staging system is called the TNM system. In this system, the T stands for the original or the primary tumor, N stands for nodes, M stands for metastases. So when assigning a stage, you will see these letters, T, N, and M. In addition to the letters, you will see numbers after each one of them, and sometimes even additional smaller case letters, such as on the screen you can see T3, N1, M0. Each of these letters and numbers give details about the cancer, including where it is in the body. All cancer has the potential to spread. It can continue to grow in the area where it started, but it can also spread through the lymphatic system and or the bloodstream, and these are what staging look at. So we need to look at this TNM system in a little bit more detail. We can begin with looking at the T category. The T category gives information about the aspects of the original tumor, such as its size, how deeply it's grown into the organ it started in, and whether it has grown into nearby tissues. You may see the things listed down at the left-hand side. TX means a tumor can't be measured. T0 means that there's no evidence of a primary tumor. TIS, it can also be called in situ cancer. Abnormal cells are present, but it has not spread to nearby tissues. Numbers after the T, such as T1, T2, T3, T4, are used to describe the tumor size and or amount of spread into nearby structures. The higher the T number, the larger the tumor, and or the more it has grown into nearby tissues. The N category describes whether the cancer has spread into nearby lymph nodes. NX means the nearby lymph nodes cannot be evaluated. N0 means nearby lymph nodes do not contain cancer. And again, numbers after the N, such as N1, N2, and N3, can describe the size, location, and or number of nearby lymph nodes that are affected by cancer. The higher the N number, the greater the cancer spread to nearby lymph nodes. The M category tells whether the cancer has spread to different parts of the body. In other words, has it metastasized? M0 means that no distant cancer spread is found. M1 means that the cancer has spread to distant organs or tissues. This detailed information of TNM is then used to assign an overall stage, often the information that's communicated to cancer patients, and it actually is a little easier to understand. Doctors use the TNM description to assign an overall stage from 0 to 4. Generally, the higher the number, the more the cancer is spread. For most types of cancers, the stage means the following. Stage 0 is a carcinoma in situ. It's very early, only in the area where it first started, and it hasn't spread. Not all cancers have a stage 0, and sometimes it would be referred to as a precancerous change. In stage 1, tumors usually small, hasn't grown outside of the organ it started in. 2 and 3, tumors larger, may have grown outside of the organ it started into nearby tissues. In stage 4, the cancer is spread through the blood or lymphatic system to a distant site in the body, which is called metastatic spread. So to summarize, TNM is the most common staging system used for solid tumors. T for tumor, N for node, M for metastases. Different letters or numbers are used to provide more detail about the cancer. Overall stage is assigned a number usually from 0 to 4. The higher the number, the more advanced the cancer is. Just as there were different ways to talk about grading of cancer, there's also different ways to talk about staging. As we discussed, the TNM system is mainly used to describe cancers that form solid tumors, such as breast, colon, and lung cancers. However, once again, to show how complex cancer is, you need to be aware that not all cancers are staged using this TNM system. Some cancers grow and spread in a different way, such as brain tumors, and cancers of the blood, leukemia, lymphoma, or multiple myeloma don't usually form solid tumors. Therefore, the TNM system isn't used for these cancers. They have their own unique staging system. In general, cancer stage can also be discussed by using words. Local or localized means that the cancer is limited to the place where it started with no sign that it's spread. Regional or locally advanced means that the cancer has spread to nearby lymph nodes, tissues, or organs. Distant or advanced or metastatic means that the cancer has spread to parts of the body farther away from where it started. Staging information can be very helpful for the patient to understand their situation and also to be able to talk about it with their doctors, their families, and friends. To help demonstrate this, I'll share the story of an older gentleman who called the Cancer Information Service. This gentleman was diagnosed with prostate cancer about 6 months ago and was to start taking medication. It was hormonal therapy, and that's what his doctor prescribed. His children, who lived far away, were constantly calling, asking questions, and kept asking why he wasn't having surgery. He shared with me that he hadn't really asked many questions when he was first diagnosed, but now was beginning to try to understand his situation so that he wasn't dreading the phone calls with his children. He knew that they were only trying to help and that they were concerned, but the calls were becoming difficult for him because he really couldn't give them any answers. We started by looking at the different types of treatments for prostate cancer and specifically looked at how treatment was determined by how much cancer was in the body. In other words, the stage of the cancer. He told me then that the doctors had told him that he had advanced prostate cancer. The doctors told him that even though they couldn't cure his cancer, there was treatment available that could possibly control it. He stated that he just really didn't think about anything else except the fact that it could be controlled. Recently, though, when his children were asking more questions, his one son told him that he knew of someone who was on the same hormonal medication, but this gentleman had also had surgery and was doing much better. The caller started then to think about his situation and wondered why he didn't have surgery. We talked about how sometimes a person could be treated with surgery when they were first diagnosed with an earlier stage prostate cancer, but when it came back years later, they might have gone on hormonal therapy. We also talked about how sometimes somebody's diagnosed with an advanced stage prostate cancer and they could still have some surgery. The surgery isn't necessarily to treat the cancer, but can be used to help relieve symptoms that have been caused by the cancer. Through the conversation, he began to understand that the advanced stage of his cancer had determined his treatment. He said that he felt better about being able to talk with his children. This is an example of how a little information about staging can help in a cancer journey. So we have reviewed why staging is important. We have discussed staging system. We just need to look at one more important detail about staging, and that is that solid tumor cancers may be given both a clinical and a pathological stage. Clinical staging is based on the physical exam, lab test results, imaging studies, biopsies, and in some cases, possible surgical exploration. Not all of these are used in all situations. Doctors determine what is necessary for each individual. Depending on where the cancer is located, a physical exam may give some clue as to how much cancer there is. For example, a doctor may be able to feel enlarged lymph nodes. Imaging tests like X-rays, CAT scans, MRIs, ultrasounds, and PET scans may also give information about how much and where cancer is in the body. For example, a bone scan may be used to see if the cancer has spread to the bone. An X-ray may be used to see if cancer has spread to the lungs. The second process is called pathological staging, and this is sometimes referred to as surgical stage. The pathologic staging is based on the examination of samples from the tumor, the lymph nodes, or metastases after they have been removed from surgery. So the pathologic stage gives more information about the cancer than the clinical stage, and this is important to know. After surgery, which is often the first step in treatment, the stage may change from what a person is initially told because they've now learned additional information during the examination of the tissues that they removed from surgery. To demonstrate this, I'd like to share just another call that I had a call from a woman who was very upset and questioning her doctors and the whole healthcare system. This was because she was initially told that she simply needed to have the tumor removed from her breast, which is called a lumpectomy. She had had the surgery, but had just had her follow-up meeting with the surgeon. She stated that they now told her she needed more surgery, and they were recommending removing the whole breast. She was very emotional and wanted to change doctors and was even talking about going to the States and paying to get what she thought would be better care. After asking many questions and speaking with her about her situation, she did say that she remembered that the surgeon talked something about finding cancer cells in the tissue that they removed, as well as in her lymph nodes. We talked about clinical staging and pathologic staging. This information helped her to understand what possibly could have happened, that being that they found more detailed information about her cancer during the surgery. So the pathological staging changed the original clinical stage, and that's why they were talking about more treatment. At the end of the call, she wasn't as overwhelmed as she was initially. She was going to talk with her doctors so that she understood everything about her situation. Having the information about staging was going to help her to have an informed discussion with her doctor so that she can understand the treatment recommendation. So even though there are many details and many complexities to cancer staging, we can do a general recap of the information we've reviewed. Staging is important in helping to plan treatment, predict prognosis, as well as predict how well the treatment will work. Generally, lower the stage, the less cancer in the body, and the better the prognosis. Cancers in the same parts of the body with the same stage tend to have a similar prognosis and are usually treated in a similar way. And for cancer patients, knowing the stage of the cancer can help them to understand their situation, help set expectations, and can truly help them prepare for the journey ahead. Staging is important when someone is diagnosed with cancer, but what we know about staging can also help all of us think about our own health. We know that an early-stage cancer can be treated more effectively and improve survival rates, so it's important to do all that we can to find cancers early. There are things that we all can do to help find some cancers early. On an individual basis, we can look at two things that should be an important part of our health, and they are knowing your body and screening. First, how well do you know your body? Knowing what's normal for you is important so that you can notice any changes. When you do notice any changes, it's important to get them checked sooner rather than later. That change to your body might not be anything, but it could be serious. You should always think about seeing a doctor if there are any changes to how you're feeling or if you have new physical symptoms, especially if they are persistent. I just want to note that there are some cancers, such as pancreatic and lung, that often don't cause any changes or symptoms in the earlier stage, and that's why these ones are often diagnosed at a later stage. It's also important to know that if you're in a certain age or population group, you can have screening tests. These are tests that can be done to find some cancers before you've even noticed any symptoms. Screening tests are available for breast, cervical, and colorectal cancer. Talk to your doctor about your personal screening plan. To demonstrate the importance of screening, I'd like to share some interesting recent Canadian statistics. More than 80% of female breast cancers were diagnosed at an early stage, stage 1 or 2. Less than 5% were diagnosed at stage 4. This is likely attributed to early detection through the organized breast cancer screening programs. However, despite the availability of organized screening programs in most provinces and territories in Canada, 1 in 2, or 49% of colorectal cancers, were diagnosed at a late stage, stage 3 or 4. Remember, early detection often means better outcomes, so it's important to take an active role in our own health. Take control of your health, see your doctor regularly, and know when you should be screened for certain cancers. For additional information on screening, you can look on our website, cancer.ca, where you can find many online tools. Today we've reviewed grading, how aggressive a cancer is, and staging, how much cancer is in the body, and we've discussed why they're important. I hope that the information we've reviewed today will help people have informed discussions with their doctors and help everyone take an active role in their own health. I want to finish by looking at one of the first slides in this webcast, the common questions when people are first diagnosed. Why isn't the doctor telling me anything? Why do I have all of these appointments? Why do I have to have so many tests? Why can't they just start treating me? The doctor said I may not need any treatment. I don't understand. Why can't they tell me how bad my cancer is? Well, I hope that you can see that each of these questions can be answered by the information we've discussed today. A cancer patient probably won't start treatment until as much as possible is known about stage and grade of their cancer, which, remember, are determined by different tests that may require a number of different appointments. Treatment may need to be started as soon as possible, or in some cases can be delayed depending on the stage. And prognosis is linked to grade and stage. Simply put, knowing and understanding staging and grading information can really help to understand a person's cancer journey. So, if you have other questions, if you're looking for additional information or support, please know that the Canadian Cancer Society is here to help. Visit cancer.ca or don't hesitate to call us at 1-888-939-3333. We would be pleased to speak with you.
Thank you so much, Rosemary, for providing such an informative breakdown of cancer staging and grading. And thank you, everyone, for watching at home. I hope you've enjoyed this webcast as much as I have. Please take a moment to check out our resource widget, the green icon with the white paper, at the bottom of your screen for links to some important resources, such as our video, What is Cancer? And Staging and Grading. You'll also find there a link to our newly released Canadian Cancer Statistics booklet, a special report on cancer incidence and stage. We'd also like to invite you to check out our peer support resources to talk to someone who's been through a similar experience. And finally, just a reminder to please fill out our survey. Your feedback is so important to us and helps us be informed for future webcast ideas. Thank you so much, and have a great day.